Good morning, everyone. We are just going to take a minute to let everyone log on. And before we connect with Dr. Marcy Dries, she'll be here today speaking about the current state of COVID-19 and how to make sure you're keeping yourself and your family safe as things shift in another phase here of what seems to be a potentially positive phase of this COVID-19 pandemic. So I will add Dr. Dries in and we'll get started. Just a reminder, if you have any questions, please put them in the chat and we will get to them as I welcome Dr. Marcy Dries to our conversation today.
Hi, good morning, Megan. How are you?
I'm doing great. Thank you so much for being here. There's a lot of questions about where things stand right now, especially after the CDC put out that new information last Friday. So can you briefly just give us a high-level overview of what that means?
Yeah, so CDC's new community levels, they felt are a better indicator of where the state of the pandemic is, and it is down to the county level. And it includes, the old system included test positivity rate and new cases. This level really looks first at number of new cases and then stratifies it versus high versus low, but then also looks at things that measure hospital capacity. So you would be at a higher level in terms of needing masks and everything if your hospitals were already pretty full with COVID versus if they're not. So I think it's a nice way to kind of balance, a leading indicator, which is new cases, with, we know hospitalizations tend to lag a little bit, but it's really important to maintain hospital capacity so that we can take care of all patients, not just with COVID.
Absolutely, and we are very proud of our neighbors. We're broadcasting live here from Newcastle County that is in the low category. I checked earlier today, our neighbors to the north in Pennsylvania, to the south in Maryland, a lot of us, Kent County, Sussex County, are saying low now on that CDC website, which is a great path forward. But what does low really mean?
So low is really, it doesn't mean zero. So COVID is still out there. And so I think people still need to be careful that this isn't like, the pandemic's not over. It's not that we've gone back to, pre-2020 way of living our lives. We still need to be aware, but it's really all about preparedness. So the most important thing is that, if you're not already up to date with your vaccines, that you get up to date. So now is the perfect time to go out and get your vaccines, make sure that you're as protected as possible. And then it's also, if you do develop symptoms or if you do have an exposure, you need to have a plan. Like, how am I going to get tested? That sort of testing, isolation, quarantine is still really important because, like I said, COVID is still out there. And so you need to respond appropriately. Luckily, home tests are much more available now than they used to be. You can request them from the U.S. government. Every household can get 4 for free mailed to their home. And obviously that doesn't happen instantly. So now's the time to put in that order if you haven't already, so that you have them when you need them. And I think there'll be another round that you'll be able to order more in the future. And then, many of the public libraries have them. Many of the pharmacies now have them. They're reimbursable by insurance. And there's lots of other opportunities if you don't have insurance. So I think, now's the time to kind of stock up on, at least having a couple home tests available should you have symptoms, should you have an exposure, so that you're ready to go. And then also, especially if you're high risk, you have underlying health conditions, you're immune compromised, you need to know, like, what would I do if I got COVID? So there's lots of treatments now available. There's oral pills, there's infusions that are all available as outpatient to keep you out of the hospital should you get COVID. So now is the time to talk to your doctor about what would the process be should I develop COVID, and kind of have that plan ready to go. For when, hopefully that won't happen to you, but it's always good to have a plan for what would you do should you test positive for COVID.
So you mentioned making sure you have some of those at-home tests. Should you wait until you're symptomatic to take one? If you're going to a large event, is it smart to take one? What should be best practice there?
So certainly you should use one if you're symptomatic. You can also go out to many of our community testing sites, which will do PCR testing. The home tests are really helpful. They're really easy. If you're symptomatic and your home test is negative, you may still want to get a PCR test because we know that those are the most sensitive. But home tests can be really helpful for determining when you're most contagious. And as we know, up to 50% of people may not have any symptoms when they have COVID. So they're really helpful if you've had a recent exposure. If you are going to like a family event, especially if there are going to be people at your event that are higher risk, like kids under 5, older adults, anyone who's immune compromised, you can help protect them by testing yourself with a home test, the day you go or the day before, as the best indicator of, am I contagious right now? And that way, if it's negative, then you know that that's just an additional way that you can protect others.
So
and then,
how can some?
Sorry, I was going to add, many of the schools also, like for kids that are in school, they have ongoing testing that's available. You have to sign up for it. It's not automatic. But my son who's in middle school gets tested once a week, just routinely. And then should he be exposed, he can continue to test negative and stay in school, as opposed to getting kicked out of school for quarantine. So that's another thing. If you have kids that are school age and you haven't signed up for that, then that's just, again, antigen testing that they do in the schools.
Absolutely, that's great. How can an individual person weigh their risk? We understand that a lot of people have removed mask mandates, so you don't have to wear a mask, say, when going to Target or running into Acme, but how should someone decide whether they want to remove their mask or how they can be the safest they can be?
Yeah. So again, part of it might be your vaccination status. So have you gotten all of your recommended boosters, and how recently did you get them? Are you otherwise high risk? If you're immune compromised, even if you were vaccinated, those vaccines might not be protecting you as well as they would for someone else. So that would be a situation where, when you're around people that you don't know and you don't know if they're vaccinated, that you might want a mask even if they're not, or if you're otherwise high risk, with underlying health conditions. So the decision comes down to, what would the consequences be should I get COVID? So that's things like, if you're at risk for severe disease, but then also, even if I got mild disease, what would those consequences be? Like if I'm a student and I would miss my exams, like that would be a really bad consequence, even if I had mild disease. Or if missing work, you don't have paid time off, or, or you'd miss like if you have a wedding coming up and you might miss the event if you were to test positive. So it's all those sorts of things. Is what's my risk of severe disease, but also what's just my risk of milder disease, or how would it impact my life even if I had an asymptomatic case and tested positive. So those are all the things that you want to balance. For myself, if I'm going to the grocery store, like wearing a mask is not that big a deal, so I'm probably just going to continue wearing it until we get super super low rates. But whereas like going out to eat, then I might feel a little bit more comfortable doing that now that we're at a low community level.
And we have our first comment coming in from our viewers, and I have a very similar question. Ches takes photos. Thank you for submitting your question. It says, how comfortable can I feel about taking an infant under 2 out into the world at this point? I'm also a new parent. I have a very similar question. How should we be weighing that risk?
So I think, the good thing is that infants under 2, should they get COVID, they are at low risk, not zero, but low risk of getting severely ill. But, again, it's really variable. So I think, and it's like, well, what are you taking your child out to do? Like, are you taking it to a place where, you kind of know everybody and their vaccination status, versus are you taking them to a big, an event where you're not going to know anybody? So, I would still probably be cautious about taking, to a public area where there's lots of close contact, especially if it's indoors. Ventilation may or may not be great. And the people will be like within that, with kind of in your zone with your child, versus if you're outdoors, and I would feel more comfortable doing that. So it is, it's a tough question. Like, we're not probably going to have a vaccine for that age group, anytime in the immediate future. We're hoping one's coming for at least 6 months and older, relatively soon. But until we get to that point, you kind of want to make sure as many people that are around your child are vaccinated and or masked as possible.
And then just traveling in general, even if your kids are older and vaccinated, what is best practice for that? We're going into spring break soon. We're going to be going into the summer, and people may be traveling to potentially medium or high places. You come from somewhere low in Delaware, but you may be going to somewhere across the country. How can you stay safe on a plane, train, any of those places?
Yeah, and I don't think the federal requirements for masking on public transportation have been lifted yet. That might yet happen. But again, like, that's a situation where, wearing a mask is probably not that big of a deal. and you don't know the people that you're sitting next to on the plane perhaps, or and you're coming into contact with just lots of different people. So that for me is a higher risk scenario, that transit, or even if you're driving, obviously in the car you're fine, but then you're stopping at gas stations or whatever. So I think, the key is obviously know the scenario. The good thing is something like, 2/3 or 3/4 of all the counties in the US are now considered low. So overall it's pretty good. But if you are going to a county or traveling through a county that's higher risk, you should know that. And it's easy to find on the internet by going to the CDC site. And then if you know you're going to a higher risk locale, then you know that, okay, when I'm there, I need to do these additional things like wearing masks indoors. The nice thing is, the weather's getting better. So there will be more opportunity to spend time outdoors wherever you're traveling. And so any of those situations are lower risk.
Absolutely. And let's touch on vaccines for a minute. There are a high number of people in the country who are still not vaccinated. What is your message about the importance of vaccine right now?
So I think, again, everyone who wanted to be vaccinated has been vaccinated by now, and many of them have been boosted. So, but we know that the uptake of boosters is not as high as it needs to be. So certainly if you've been vaccinated more than 5 months ago, go ahead and get your booster now. And you'll be in good shape should we start to see an increase in the spring or over the summer. If you've never been vaccinated before, I think many of you have had COVID, and so that does provide some protection. But we also know that the immune response that we get from vaccine is much less variable than it is after a natural infection. So some people after they've gotten COVID have an extremely high immunity, but some have none. And you don't really know which one of those people you fall into, whereas we know there's a pretty consistent response to vaccination. One of the things that just changed recently was the CDC said, when we first rolled out vaccines, the interval between dose 1 and dose 2 was relatively short, 3 weeks for Pfizer, 4 weeks for Moderna. They've now said that people may consider that the optimal interval between those first 2 doses may be as long as 8 weeks. And the reason for that is we know that vaccines work better when they're spaced out a little bit. So it was a balance between getting people fully vaccinated as quickly as possible at the risk of not having the longevity of vaccination that we would see with a longer interval. So you may get a more robust immune response by spacing out those 2 doses. And then the other thing that we've seen is that this is particularly important for men under the age of 40 who are at a low but increased risk of myocarditis, pericarditis, is that when those doses are separated out, that risk after that second dose is much lower. So that population in particular, if that's one of the concerns you've had about why you didn't want to get vaccinated, you can certainly really decrease what's already a pretty low risk by just delaying your second dose a little bit. They don't recommend that for kids under 12. People over 65, or anyone who has a situation where they need to be protected sooner than later, like before travel or something like that.
So you mentioned in the beginning of this conversation that COVID is not over. So before I let you go, let's make that very clear again and talk a little bit about what really is important people understand today.
Well, I mean, again, I think, it's great to be at this place where we're not so stressed about everything and we have to really shut down society. I think we have to learn to live with COVID. It's not going away. It's going to become endemic, meaning we'll continue to see cases. And so, people just really need to protect themselves, again, as best they can through vaccination, ideally, and boosters. We don't know. I wouldn't be surprised if there's another booster recommendation in the fall. We don't know that yet for sure. But we're hoping that once it becomes kind of a low-level endemic disease, we won't have to be getting all these vaccines all the time. Well, there'll be enough kind of immunity from our past vaccines and our past infection that rates will stay low. But there will always be people at risk, and so you need to do whatever you can do to minimize your risk. And again, that's through vaccine, it's through testing, isolating or quarantining if you're exposed or infected, and helping, thinking not only of yourself but all the people that are in your circle, and how can you keep everybody as protected as possible.
Absolutely. Dr. Dries, as usual, thank you so much for being here and sharing incredible information. And if you're watching and have more questions about COVID-19, please visit christianacare.org. Continue to follow us here on Instagram, on YouTube, on Facebook, on Twitter, and we will continue to share the most up-to-date and important information about this pandemic as we continue on into the fall or the spring and the summer. Thank you so much and have a great day.
Thank you.